We are at the analyze phase of the DMAIC. The goal of the analyze phase is to identify the root cause or causes of a presented problem. This phase can be used to identify smaller issues that could be improved to resolve the problem. To review, the analyze phase will be a part of an opioid overdose prevention program. The county health department plans to distribute naloxone to county residents. The CQI team was asked to come in and evaluate the plan for naloxone distribution. We'll assume the define and measure phases have already been completed. A tool that can be used is the FMEA, which stands for Failure, Modes, and Effects Analysis. Let's dive into this tool and take a close look at our naloxone distribution program. We will use FMEA to identify potential ways our process can fail, assign a risk value to each failure, and prioritize actions to reduce the chance of that failure. The first column is the process step and input. We will enter one process step or input for each row, starting with our first row. Let's say our first input is our actual naloxone supply. Second column is to identify the potential failure mode for this process step. So how might our opioid overdose prevention program fail without our naloxone supply? Or what can go wrong at this step? Failures can be any error or defect, potential or actual. So let's say a possible failure is a limited public access to naloxone, meaning we don't have enough supply. Next is the third column, potential failure effect. We can ask, what is the effect that a particular failure mode can have on our process? This could also be an effect that is perceived by the customer or user of that process. For this example, the effect might be an increase in overdose deaths because we didn't have the naloxone supply we needed. The next step is technically the fifth column, potential causes. Column 4, 6, and 8 are completed later. Here we can ask, what were the cause or causes of this failure? There could be several. If there are, think of the most important or prevalent causes and list them in order of importance. So our causes could be the overhead cost of naloxone was too high, there was a policy that made it difficult, or maybe there was a shortage that caused us to run out. When we think about the reasons that the process went wrong, we might practice something called the 5 whys. In this, we ask ourselves at least 5 times, why? This is a powerful tool to use during a root cause analysis. By asking ourselves why at least 5 times, we usually will get to the core of our problem. So, let's explore with Susie. Hi, Susie. Susie and her friend Sam ate at a food truck yesterday. They got sick with other customers. The identified problem is they got sick. But why did they get sick? County officials identified the cause of sickness was exposure to salmonella. But why did they get exposed to salmonella? The food was contaminated and being served. But why was it contaminated? The food was not properly handled during preparation and cross-contamination occurred. But why did that occur? Employees were not aware of cross-contamination risks and did not wash their hands properly. Well, why were they unaware? The employees had not been trained with a ServSafe certificate because it wasn't required. Well, why wasn't it required? We could technically take this a step further and find out that the current policy does not require all food truck employees to complete a ServSafe certification. This could be the core of our problem, and perhaps we'll recommend a policy change to require ServSafe certifications for all employees in the future to prevent this from happening again. Next is column 7, current controls. What process do we have in place that can prevent the potential cause of the failure mode from occurring? Maybe we have a reliable funding source. And now we go back to columns 4, 6, and 8. Your team comes together to give each row a numerical value by assessing the severity, occurrence, and detection. The combination of these values will provide the team with a risk priority number, or RPN, that will be used to help the team decide which process step they should tackle first. But before you begin, the team needs to agree on an interpretation of the rating scale so that each value is measured in the same way. Let's start with severity, or SEV. What is the importance or the impact on the customer? If we don't have the naloxone supply, the impact on our harm reduction program could be very serious. The team decides to give this a severity of 10. Next is the OCC, or occurrence. How often does this step happen, or could this step happen? The team is more generous with the possible occurrence, and we rate this one a 3. Last is detection, or DET. How likely are we to detect the failure? Let's assume our team doesn't have a method to track the current naloxone supply or national naloxone supplier and back orders. They rate detection at a 9. So now we just multiply these three numbers to get our risk priority number. And for this example, our RPN is 270. You repeat this for each process in the FMEA chart. After you're done, you start with the process that has the highest RPN and then begin with the actions recommended column. What is the most effective and sustainable way to improve our process? Then last is the plans and responsibility. This is who is responsible for the action. It's critical that we assign a specific person to each task in the plans and responsibilities column because that creates real accountability. Without a name, there's no clear ownership and important follow-up steps might be missed. Naming someone also makes communication easier and ensures the corrective actions actually get done. It's a key part of turning this analysis into real improvements and not just a checklist. That's Analyze. You got this.